In most typical male pattern baldness, it affects the crown in this area and the receding hairline right along here. And we see that in me because I am typical of male pattern baldness. And I am joined by Dr. Ed Domanskis. And Dr. Ed, you've been on the show for many months. I did not realize that you also do hair transplantation. Tell me a little bit about that.
Oh yes, hair transplantation we've been doing for quite a long time. Ever since I got into practice, has changed quite a bit, as you know. Before they used to have rows of hair. Now we actually do individual plugs. And in most cases we can do the surgery in the office under a local. It does take quite a long time. I mean, probably 4 to 6 hours actually in the office. But during that time, we take the grafts, which are primarily from the back, where normally the hair does grow until you get much older, and then I have actually technicians specialized in this that actually cut every single hair out, and then we determine where we're going to put them. And in most cases, we take probably about 700 to 1,500 at one sitting, yeah, and we're able to transplant it primarily in the front, like you have, as well as in the back. It does work. What happens is that the hair actually goes into shock. It grows for maybe several weeks. It goes into shock, and it starts growing again. So actually, it does take a longer time for it to develop, but it's much more natural looking. And most patients are very happy with it.
So would you say I'm a candidate for that kind of procedure?
I think you probably know yourself you're a candidate, Ron.
Because I've got the hair on the sides and in the back.
Yes.
And, in all honesty, it is something that I've thought about doing for quite some time.
I'm sure you want to replace your hat, finally.
Yeah. Then I could lose the hat.
Right.
So let me think on that. We may be doing a whole series of segments on you taking care of my hair. But in the meantime, if someone wants to get more information, do you offer free consultations for that?
Oh, yes. If they mention your name, for sure.
Perfect. And this is for men and women, right?
Yes, it is. Actually, that women do experience hair loss too. It's not only for men, and I think that most patients are maybe have tried minoxidil or different hair preparations, but really the only way to do it is hair transplantation.
So if someone wants more information on getting that procedure done, how do they get a hold of you?
It's very easy. Just call my office, 949-640-6324, or find me on the internet.
All right, well, and I may be your next hair transplant patient.
We'll look forward to seeing you. Ron, thanks again.
Thank you.